young and breasted one. Lift your voice to your King. Let him hear your worship tonight. Let him hear your worship. Come on, raise your voice. Let an incense rise to the heavens. Let an incense rise to the heavens. You can do better than this. You can do better than this. Santali Barando Satele Papai Errange Shomanamando Setai. If you have 10 more seconds to offer your worship, what would you say to him? What would you say to him? We welcome you, sweet Holy Spirit. We thank you for your presence here already. Glory to your name. Honor to your name. Thank you, Lord. For in Jesus' name we've worshipped. Please be seated as kings.
Introducing to you a distinguished physician, an accomplished academic, a passionate researcher, and a dedicated specialist in the field of urology, Dr. Solomon Ayimba. He is a graduate of the College of Medicine and Surgery at the University of Nigeria. After his housemanship in National Youth Service Corps, he returned to the University of Nigeria Teaching Hospital, where he did residency training and qualified as a urologist. He is a fellow of the West African College of Surgeons. He is a consultant urologist at the University of Nigeria Teaching Hospital, Ituku Ozala. He also consults in Patrick Osuji Specialist Hospital, POSH, New Haven, Enugu. He is a lecturer at the College of Medicine, University of Nigeria Teaching Hospital, Ituku Ozala. Dr. Ayimba has a great interest in research and publication. He has authored 37 publications, many of which were published in high-impact journals. One of his publications is a jaw-breaking case report entitled Toothache as the Leading Clinical System of Metastatic Prostate Cancer, published in Nigeria Journal of Medicine. But beyond the degrees, titles, publications, and professional accomplishments is a man who understands the importance of family, relationships, and service. He is married to Chinenye Ayimba, and they are blessed with 3 lovely children. Men of the Mentor. Men Forum today, we are privileged to have among us a man whose life represents a beautiful blend of medicine, academia, research, leadership, family, and service. With a standing ovation, let's make welcome to the podium this evening, Dr. Solomon Ayimba.
During COVID, we stopped consulting rooms in UNTH. We asked to go outside, there were canopies where we were consulting because of COVID. One of the patients, a man in his 70s, came in with his daughter. So when they sat down, I asked him, what symptoms I have, do you have any urinary symptoms? Asked me to, he said that he didn't want the daughter to be there. Usually, when we see that people want their relatives to be there, to be around, because sometimes when we write medication, they forget the medications. So, man told me that he didn't want the daughter to be there. Meanwhile, when they came in, the man told me that he had difficulty in passing urine. So when the daughter left, because it was open place, the daughter went behind and sat down and asked the man, which symptoms are you having? He asked me to take my tone down, I shouldn't shout, and told him that he wasn't having the right symptoms. So he had made the curve. Remember we talked about health curve. So he has, it's one of the curve. Men don't joke with your erection. So we started discussing, and he didn't want the daughter to know about the erection problem. But that was an elderly man. The one that happened that pained me a lot. I was operating in a 2 division hospital, and I got a call from Posh. Posh is one of our partners. He was mentioned here. They are behind. The call came around 1 p.m., 2 p.m. That's someone was waiting for me in Posh. Posh is Patrick Osu Special Hospital in New Haven. I told them that I was operating, I would not be there. The person should come another day. They called back, that person will wait. The person wants to wait till I see them. By 5 p.m. they called again. The person was still waiting. So by 6:30 when I finished operating in a 2 division hospital, I was tired, so driving back home. I had to go straight to Posh. So I saw the young man and the wife. What was the problem? They got married and no erection. So the wife was the one that said that they must wait for me to come around. So after examining him, it was prostatitis. So I'll come to prostatitis when I talk about prostate. So these things happen, it's among us. See, erection is a complex neurovascular process. It's quite complex. See, when Bible said that man is wonderfully and fearfully made, I think about 3 things. Number one, the heart, at the age 22, the heart starts beating. The heart will beat, woman delivers, the heart will beat until man gets to 70 years, 80 years. That's wonderful. So we are really wonderfully and fearfully made by God. If that has stopped beating, it's miscarriage. Remember, by day 22, it starts beating. You can check internet, we are talking embryology. If that, for any reason, before 9 months, that has stopped beating, it's miscarriage. So it has keeps on beating until the person gets old. Another one is kidney. Blood will enter the kidney. What we call that is urine. That is a big machine. The kidney is, if you're passing urine without the blood, then the third one is erection. Erection is very complex. From the brain, from hormones, from nerves. So there are a lot of things that can cause erectile dysfunction. There are many types of erectile dysfunction of stress. You can experience weak erection. It's not one day stress, but when it's consistent, notice that. So if you experience that, please you need to check. And then now for anxiety, when we have people with weak erection, I like to speak with the spouse. Because a lot of time, if the spouse then is putting a lot of pressure on the man, there will be anxiety, and that weak erection will keep on occurring. In fact, to be a vicious cycle, keep on recurring because of the pressure. First, if a man is depressed, and there will be weak erection, that's psychogenic. Another one is neurogenic. From the nerves. See, there are nerves that, responding for erection, they supply the penis. Also, other things that can affect nerves, diabetes can affect nerves, all the nerves in the body. So if a person is diabetic, can affect the nerves. So that one is neurogenic erectile dysfunction. Another one is vasculogenic. You see, when a man, middle-aged elderly man has weak erection, it's very important the person checks his cardiovascular status, because maybe the first point that there's problem with the cardiovascular status. Maybe plaques deposit in the blood vessel. It can cause weak erection because blood will not be flowing freely to the penis. The same thing may happen to blood vessels supplying the heart. So you see someone having weak erection, the next 3-4 weeks, heart attack. So they are related. So weak erection, don't go and go to a chemist and buying drugs. It's better to see a physician, urologist or cardiologist, because issue with the blood vessels can cause weak erection. That one is called vasculogenic. The fourth one is endocrine. Has to do with hormones, chemicals in the body. Diabetes can cause weak erection. See, when the sugar is high, it affects. In fact, diabetes affects the whole body system, affect the eyes, the kidney, tissues. Person can have wound that will not heal. Then of course can cause weak erection because of effect on the nerves. So then also another endocrine have low testosterone. See, as men advance in age, testosterone will be dropping, and that may affect erection, that may affect libido. Even some people, for some reason, testosterone may be low. I've seen a lot of young person between 30 and 40. Testosterone is very important. One of the things we check when someone complains of weak erection. Okay, also on vasculogenic, you see, smoking is not good. See, smoking will cause problem with the blood vessels. There may be deposition of plaques that may affect that's atherosclerosis that may affect blood flow to the penis. So smoking, there's no advantage in smoking. So that will affect the blood vessels. Excessive alcohol intake can lead to weak erection. The next cause is drug therapy. Remember, I mentioned psychogenic from the brain, neurogenic from nerves, vasculogenic from blood vessel, endocrine. Fifth one is drug therapy. There's some drugs that cause weak erection. If someone has some mental issues, drugs that makes person to sleep can cause weak erection. There's some drugs given to diabetic, to people that are hypertensive, that cause weak erection. That's what we call alpha-methyldopa. When the person takes it, weak erection will set in. Also, some drugs for prostate enlargement can cause weak erection. So this drug therapy, drugs. So if someone has weak erection, normally asks about drugs. What's the way forward? One is to identify the cause of the weak erection. I've mentioned different causes. So if you have weak erection, go and buy medication in chemist. That is not proper. You've not identified the cause. There's some people that are diabetic, they've not checked their blood sugar. 50 years, 60 years, they've not checked their blood sugar. They're weak erection testing, they're taking drug for erection. When they come to hospital and check the blood sugar is high, 400, 500. So it means that the cause of the weak erection is diabetes. But person has gone to pharmacy to take drug. No, so you need to, it's not a simple thing that you go and buy drug from the chemist. You need to see a physician and then know so that the person will take it up from there and then examine you properly and do some medication. So first you need to see a physician. Then lifestyle modification. Lifestyle is very important. Someone mentioned it in one of the speakers. Lifestyle is very important. If you are obese, it can cause weak erection. So exercise is very important to lose weight. When we see people that are obese and we encourage them to lose weight, exercise is very important. Of course, dietary modification. Many of the problems that happen in the Western country, many of the diseases, they are not coming to our environment. For example, prostate disease, kidney stone. I want to mention urology. In the 80s, these things were not common, but we are adopting Western lifestyle, and we're having their problems. This morning, I wanted to be here by 9. I went to Niger Foundation Hospital. Someone was in pain, serious pain. We did a scan, was stone in the kidney. So I went there again, second time, to look at I asked them to do what is called CT scan. Person did ultrasound before. Severe pain, stone. See, these are coming to us because we are adopting Western lifestyle. People no longer buy oranges. They go to fast food shops and buy orange juice. People no longer take pineapple. They take pineapple juice. We eat refined food. Somebody, doctor mentions Coke and Oba. So refined sugar, all these things, we are adopting their lifestyle, and the diseases are coming to us gradually. I will emphasize this on when I get to prostate. So lifestyle modification is very important. Avoid refined food. If you are 20s, 20 something, you can be licking ice cream. If you get to 40, start with avoiding those things. Avoid processed food. Avoid refined sugar. Eat healthy diet. Exercise is very important. Fruits and vegetables, very good. Very good. Watermelon is very good for erection. People that have erectile problem. Somebody called it natural Viagra. Viagra is a drug for erection. Natural Viagra. So watermelon is very important. It contains what is called L-citrulline that we converted to arginine and then to nitric oxide. Nitric oxide is very important for erection. Most drugs for erection will lead to production of nitric oxide, and that will help with erection. So watermelon is very good. So take a lot of watermelon if you have such issue. Then of course cucumber, banana, tiger nuts, very important. You can do tiger nut juice. It helps. So just if you want to modify your diet, that will help. Exercise, then sleep well. Stress, as I said, can cause. So you need to get some sleep, and also need medical therapy. Sometimes there may be need for drug therapy, either to treat infection, which are come to prostate, or to boost the erection. Sometimes there may not be any reason for the erection. If testosterone is low, we give drug to take testosterone up. Once it's low, if you're taking drug for erection, that will not help much. So we need to bring up that testosterone level. So erection problem can cause problem in marriages. I was nearly converted to marriage counselor, some time ago, because other people were waiting for me outside, but the couple came in and we were discussing. The woman was shouting. He doesn't want to take his drug. They are nearly converted into marriage counselor, so it can cause marital problem. But it's good to seek for medical therapy early. Don't go and be taking drugs when you've not sought medical therapy. Prostate problem is on the increase in the environment. So I'll talk about 3 problems: prostatitis, prostate enlargement, and prostate cancer. Last time I was invited in a program like this, I dismissed prostatitis in 3 to 5 minutes. When I looked at the people, they were elderly. I used 3 to 5 minutes to dismiss prostatitis and dwell on prostate enlargement and prostate cancer. I won't do it here. I'll do the reverse. So I'll dwell on prostatitis. Prostate is an organ in every man. It's just below the bladder. If this is the bladder, prostate is below. Prostate is very important for fertility. If there's no prostate, they have no fertility because it helps to produce fluid that helps the sperm to survive in female genital tract. The normal size is 15 to 25 grams. 15 to 25, but as men advance in age, prostate will start enlarging in size. When men get up to 40 years, the prostate will start enlarging. Apart from enlargement, it can get infected. So when it gets infected, or when it's enlarged, or when it's cancerous, there are some symptoms that may present. And those symptoms, if we do lab tests and examine the person, we can, cleanse the diagnosis, whether it's prostate infection or enlargement or cancer. See, when the appendix is inflamed or infected, it's called appendicitis. So when the prostate is inflamed, we call it prostatitis. Symptoms. See, they are similar. All these things I mentioned, prostatitis, prostate enlargement, and prostate cancer, the symptoms are similar. Number 1 is called frequency. Person goes to pass urine frequently. Every 1 hour, person goes to pass urine every 1 hour. Frequency. If you are advanced in age and have frequency, don't say it's cold weather. Unless it just happened once. Once it persists, it's not cold weather. There's problem. Every hour I go to pass urine, it happens Monday, Tuesday, it happens for 3 weeks, for 1 month. It's not advancing age. Some men come late because I'm going to come to prostate cancer because they say it's advancing age. They know that prostate cancer that is causing that problem. So if you're a young person, you're urinating frequently, you're not diabetic, you take your blood sugar, you're not diabetic, it's abnormal. Number 2 is called nocturia. That happens at night. Prostate problem, frequent urination, actually with prostate, is common at night. If it's diabetes, maybe all through morning and afternoon. But when that frequent urination happens mainly at night, it's most likely prostate related. Don't put the blame on Nescafe or coffee, or put the blame on weather or rainfall. Once it's persistent. Number 3, urgency. You see, when you have urge to pass urine, you can postpone the urination. If you're in a bus, you can wait for the bus to get where it's going, or maybe an exam, you can put, but when you cannot postpone urination, it's called urgency. You always rush out to pass urine. That means something irritating the bladder. For a young person, most likely prostatitis. For people that are advanced in age, maybe prostate enlargement or prostate cancer, because if there's cancer in the prostate, it may be irritating the bladder. If it's close to the bladder, it can also irritate the prostate. Number 4 is urge incontinence. So urgency, person cannot postpone urine. Urge incontinence. Before the person gets to the restroom, urine start coming out. That is called urge incontinence. Can happen in prostatitis, happen in prostate enlargement. I've mentioned 4 symptoms. The other 4, weak stream. Person goes to pass urine, it doesn't flow out freely. Person have to strain to pass urine. So it can happen in prostatitis, but mainly in prostate enlargement. But I won't take symptoms at the same time. But I won't repeat the symptoms when I get to prostate enlargement or prostate cancer. So most commonly in prostate enlargement. So when person gets to pass urine, person waits for some time. Urine will not start coming out. person waits for some time, we call it hesitancy. Then when the urine start coming out, the stream will be weak. That's weak stream. So the person then strains to pass the urine. I mentioned 3 things now. One is hesitancy. The person gets to the restroom, the urine doesn't start coming out. Hesitancy. Number 2, when the urine start coming out, it will be weak. We call it weak stream. And number 3 is strain. The person strains to pass the urine. So that after 4 plus 3, that's 7 symptoms. Then the 8th one is feeling of incomplete emptying. Person goes to pass urine. After, person feel that there's still urine in the bladder and goes back again. So that person wakes up several times at night to pass urine because it doesn't empty the bladder. That's what they call terminal dribbling. After passing urine, person wears the clothes, but urine start dropping, continue dropping. We call it terminal dribbling. These symptoms can happen in prostatitis, it can happen in prostate enlargement, it can happen in prostate cancer. If it's prostatitis, when this happens, the person comes to hospital, we always examine the person. Very important thing is to put the finger in the anus and press the prostate. We call it distal rectal examination. Distal rectal examination. Put the finger in the person's prostate and press in the person's anus and press the prostate. The prostate should be painless when it's touched. So if I touch on the shoulder, I just want to have pain, shoulder or on the palm. But if there is boil ototo in Igbo, that place will be inflamed. When it's touched, there'll be pain. So when prostate is touched, it should be painless. But when it's painful, it's inflamed, it's prostatitis. And the person will not have pain, or unless it's like, if it's appendicitis, the person will start having pain immediately. But for prostate, because of difference in the innervation, is by examination. The person will not have pain, the person will have these rare symptoms. Then when you press, it's very painful. And that's prostatitis. 3 common ways to get prostatitis. Number 1, unprotected sex. Number 2, masturbation. Number 3, toilet infection. Unprotected sex, masturbation, toilet infection. Through any of this method, the bacteria called E. coli will enter the tip of the penis and then migrate and lodge in the blood in the prostate. Some men will have pain in their testes. The problem is not from the testes, the problem is from the prostate, because there's connection between the prostate and the testes. So when people come to us and say they have pain in their testes, we normally examine the prostate. A woman brought her son to me, secondary school, has this frequency urgency of children. So I was wondering, is it not prostate symptoms? So I asked the boy questions, everything. No. I sent the mother out and asked her again, masturbation. so I said, I got you. So I brought the woman in and then with some medication. Masturbation caused the problem. So because it's recurrent, he kept on introducing infection into the tip of the urethra. They were just migrating up to the prostate and be lodging there and multiplying. In fact, the boy was crying while he was passing urine. He was crying, several times at night, pain. Of course, we started drugs. The person I said that was waiting for me in Porsche till night. After asking questions, I examined his prostate. When I pressed the prostate, he nearly jumped out of the bed. It was very painful. Sperm passes to the prostate before it comes out to the urethra. When a man ejaculates, the semen is stored in epididymis close to the testis, so it will pass through the prostate before it comes out. If the prostate is infected or inflamed, sperm is very sensitive, and sperm passes through the prostate, they will all die off. So that's how prostatitis causes infertility. So apart from weak erection, it can cause infertility. That's what I want to tell you now. So it can cause infertility because if you clean the sperm, and if you don't know, you don't know what's happening. If you don't meet a urologist, general practitioner may not really know what's happening. So prostatitis can cause infertility, can cause weak erection. The nerves for erection lie close to the prostate. So when they are infected, the nerves will be numbed. When we want to do operation, sometimes we give injection called local anesthesia. If you want to cut the person here, if you do the local anesthesia around that place, the person will feel pain when the needle is going in. Wait for 3 minutes, 2 to 5 minutes, then cut. The person will be awake, or if it's a minor operation, the person will awake and believe that you cut. The person will not even know, because that place has been numbed. The person will not know. The person will look at you, you cut the place. Prostatitis numbs the nerves for erection. The nerves for erection, they lie close to the prostate. So when there's prostatitis, the nerves will be numb. The person cannot perform. If you make the person up from today to tomorrow, erection will come and drop. The person will take medication and then it will help improve erection, but after some time it will drop. So way forward, antibiotics, very important. Antibiotics treatment. So it's not all just drug for erection. So when people go and take drug for erection and for 3 months, 6 months, they will not get relief. So we need to see a urologist. When the person is examined, I found out that the prostate is infected. Please wait for antibiotics. For a long period, I waited for 6 weeks for somebody, the person screamed, how will I tell him for 6 weeks? You see, Americans give for 3 months. If precise, Americans give antibiotics for 3 months and then repeat examination. British says 6 weeks. So we follow British protocol. So if a doctor gives antibiotics for 6 weeks, don't say it's too much. In fact, the day I wrote it for one person, the pharmacist told the person that it's too much. I will take antibiotics. But they are safe antibiotics, safe for the body. So we take antibiotics for 6 weeks and then they examine the person. That's British protocol. But Americans will give it for 3 months. No, 6 weeks times 2, 6 weeks times 2 is 3 months. So that's the treatment. Then of course person be on some medication, antioxidant, then a drug that will help to improve erection. But I've told you about lifestyle, the fruits that will help: watermelon, tiger nut, cucumber, banana. This will help with improve erection. But you need to address the problem. If you have prostate infection and you are taking watermelon, you need to bring in trailer load of watermelon to help you. Prostate infection, if not treated it, you can't take in watermelon, then you need trailer to bring. So you need to treat that infection first. And the only way to know is by, if you do urine test, it will be negative. No infection because the infection is not in the bladder, it's in the prostate. So if you submit sample for it, they will say no infection. If you don't meet urologist for examination, you will not be treated properly. So that's prostatitis. It can affect erection. It can cause low sperm count. It can cause low sperm motility. It can cause reduced quality of life because person may be having serious pain. People, men don't come to hospital early. They attribute it to weather. The people will cold. Some people take alcohol. Said, I know I took alcohol that day. But it's prostate enlargement. So it's good for men to be proactive about their health. So get to hospital early. Don't wait when things get wrong. A lot of people we see in hospital, things have gone wrong. But the first time they will say that it's weather related or relative. Somebody was passing blood and urine. I say because he was involved in land disputes. It was prostate cancer that was causing problems. So he came to hospital late. It was last dispute. He was telling me that he knows the reason. I don't know. The PSA is high. Say that he knows the reason. So men attribute to a lot of things. So coming to hospital on time. Start taking herbal medication. Some people go to internet and be taking Lyme. Please always see a doctor. There are many doctors on TikTok now. Some of them secondary school leavers open TikTok and then start talking nonsense. So please need to see a urologist when you have any of these symptoms. Prostatitis and prostate enlargement, PSA may be normal or elevated. PSA is called prostate-specific antigen. It's a test that we do for prostate. Whenever a man is up to 40 years, person should do his PSA. It's called prostate-specific antigen. Normal is 0 to 4. Most people we see in the hospital, their PSA of 70, 80, 90, 100, because they don't start checking it on time. So when it's up to this, it means that there's cancer has already spread. So if there's prostate infection or prostate enlargement, PSA